So scars from acne are really frustrating and they usually will not just go away, which means getting a dermatologist involved can really help. My name is Dr. Morgana Colombo. I'm a board-certified dermatologist in Northern Virginia and founder of Vida Derma, a science-backed skincare line. Today, I'm going to walk you through 4 proven acne scar treatments. I'm going to rank from least effective to most effective based on the latest research. Acne scarring affects up to 95% of people who have had moderate to severe acne. And the good news is in 2026, we have better treatments than ever before. So let's get into it, guys. Acne scars come in different types. You've got ice pick scars, which are narrow and deep, box scars, which are wider with sharp edges, and rolling scars, which create wavy, uneven texture. The best treatment for your scars depends on which type you have, your skin tone, and your goals. So always talk to a dermatologist before starting any treatment plan. So number 4, the least effective of the treatments I'm going to talk about, but it's the most accessible. These are the chemical peels. Chemical peels are very accessible to a lot of patients with acne scarring. They use acids like trichloroacetic acid or TCA and glycolic acid to remove damaged layers of skin and stimulate new collagen growth. For deep ice pick scars, there's a technique called TCA cross, where a high concentration of acid is applied directly into each individual scar. Studies show that patients see good to excellent improvement with this method, but it's typically also combined with other treatments. Chemical peels are affordable and widely available, which makes them a great starting point. And here's something interesting from the research. When chemical peels are combined with laser treatments, patient satisfaction actually ranks among the highest of any combination. So even though peels are the least aggressive option on the list, they still play an important role, especially as part of a bigger treatment plan. Number 3, subcision. This one sounds a little intimidating, but it's actually a pretty straightforward procedure. If you have rolling or box scars, they're often tough fibrous bands underneath the skin. They're pulling the scar down. Subcision is a minor surgical technique where a doctor uses a small needle or blade to release those bands. What I find important about subcision is that it's rarely done alone. International expert panels recommend performing subcision before laser treatments to get the best results. It can also be paired with dermal fillers like hyaluronic acid to add volume underneath the released scar. Studies show that combining subcision with either fractional laser or fillers produces significantly better improvement than subcision by itself. Think of subcision as the foundation work. It frees the scar so that other treatments can do their job more effectively. Number 2, microneedling with radiofrequency. Microneedling uses tiny needles to create controlled microinjuries in the skin, which triggers your body's natural healing response and boosts collagen production. Radiofrequency microneedling takes it a step further by adding heat energy into the deeper layers of the skin for even more remodeling. One major advantage of microneedling is safety across all skin tones. So if you have darker skin, you're usually at higher risk for a side effect called post-inflammatory hyperpigmentation, which is basically dark spots that develop after a procedure. Research shows that radiofrequency microneedling carries a much lower risk of this compared to ablative lasers, so making this a preferred option for patients with deeper skin tones. Adding PRP or platelet-rich plasma to microneedling makes it even more effective. PRP is made from your own blood and contains concentrated growth factors that speed up healing and collagen production. A meta-analysis found that microneedling plus PRP nearly triple the odds of achieving significant clinical improvement compared to microneedling alone. Number 1 are fractional ablative lasers such as CO2 or erbium, especially combined with PRP and or subcision. This is gold standard for moderate to severe acne scars, and the research backs it up consistently. Fractional CO2 laser or erbium They work by creating thousands of tiny columns of controlled injury in the skin. The surrounding healthy skin acts as a reservoir for rapid healing, while the treated areas undergo deep collagen remodeling. But here's what the latest evidence really highlights. It's the combinations that make this treatment stand out. Two large network meta-analyses, one from 2026, both found that CO2 laser combined with PRP or subcision ranked at the top for acne severity reduction, scar grading improvement, and patient satisfaction. CO2 laser plus PRP was the #1 ranked treatment for reducing overall scar severity scores, and CO2 plus subcision ranked highest for improving scar grading and satisfaction. I sometimes combine those lasers with a biostimulator called Sculptra and get great results. Adding PRP also appears to reduce side effects. Research shows it may actually lower the risk of post-inflammatory hyperpigmentation and acne flare-ups after laser treatment. But the trade-off is downtime. Expect about 5 to 7 days of redness, swelling, and peeling. And if you have a darker skin tone, your doctor will likely use more conservative settings and may recommend pre-treatment with a skin lightening cream to minimize pigmentation risks. So here is the bottom line, guys. The most effective acne scar treatment in 2026 are combination therapies. No single treatment does it all. The best results come from pairing procedures together tailored to your scar type and skin tone. If acne scars are something you're dealing with, talk to a board-certified dermatologist who can evaluate your skin and build a personalized treatment plan for you. If you found this helpful, make sure to like, subscribe, and drop a comment below with any questions. I'm going to see you in the next video. Thank you.